We went there with different purposes. We went there for doing the medical support, but not only in that small clinic, but also in the surrounding villages. So we sometimes I'll spend all the work in the clinic, but we also went to the villages around. The roads are not very good, so they don't have access to any kind of medical support, not doctors. So it's difficult for them. We were in the clinic, we see all kind of patients, like a health center, um, but also working as emergency because they have nowhere to go. So if they have an emergency, they go there, and even if we have to take them to the hospital, we'll carry ourselves, if there are no ambulances there. So we see all kind of patients morning and afternoon. I lecture some courses of ultrasound with POCUS in Portugal, and we use a lot of EchoNous ultrasound machines, and I need a device to take there. And I spoke with EchoNous, or the company I work with spoke with EchoNous, and they were really great to lend me a EchoNous device. I took a Cosmos ultrasound machine with a Torso One probe. They don't have access to healthcare providers and services. And there's a lack of imaging resources in the areas. So imagine the closest hospital there is about 30, 40 minutes by bumpy roads, and over 1.5 hours from some villages around. So, and they only have X-ray in that hospital. No CT scan, no other, no ultrasound machine. So having a portable equipment to go everywhere was perfect. I took it to the clinic, I took it to the villages when we go around. I even took it to the hospital to help there. Yes, so it was perfect. Did it make a difference taking the ultrasound machine? Of course it did. Yes, it was very important. But I could do it. I could go without it, but it wouldn't be the same. Even in small cases like one of the nurses in the clinic, she was pregnant. She was 30 something weeks. She had never seen a baby. So just being able to show her the baby, she was like, oh, she was like caressing the screen of the ultrasound machine. Oh, it's complete. He has a head, he has two arms. So it was very nice. Because it's very important. Doctors are seen as very disconnected with the patients. It makes you close to the patient because everything we have to be in contact with the patient. We have to. So focus is very important for the bond between the doctor and the patient. It's a very complete device for a portable device. It has everything, both Dopplers, yes, the multi-purpose probe. You can do the cardiac, you can do abdominal. It's very good. One particular thing that Cosmos has, I haven't seen in other devices. They have like a notch on the back that looks like a computer mouth. So you can control the depth, the frequency, and start to making the movie. You can take the pictures. I like to volunteering. Probably I'll try to go next year again. Once you do one mission, once you go one time, it gets under your skin. It's just you have to go because it's very well overwhelming. Yeah, you make a difference. It's a very uneven world, so we try to balance a little bit more with. So yes, definitely.